helping make your life easier. Moms Every Day.
Some researchers say most people who think they are allergic to penicillin really are not. So how do you know for sure? I'm joined today by allergist Kurt Kimberg, and we're going to learn more about this allergy. Nice to see you.
Nice seeing you, Taryn.
Yeah, so how common is the penicillin allergy?
1 out of 10 people will report having an allergy to penicillin, so it's fairly common.
Okay. What kind of reactions will you get? I know typically you might introduce penicillin to a child for the first time and they might have a rash or something.
Right, you can get a rash, sometimes hives, sometimes just redness of the skin, but sometimes those reactions we have to kind of decipher whether that's truly a penicillin allergy or not.
Yeah, so after your child reacts in that way, what do you do as a parent? Do you just say they're allergic to it?
Sometimes that happens, and you could say that they're allergic to it. Then you have to take other antibiotics that are non-penicillin, and sometimes that might lead to you taking more expensive antibiotics or maybe developing a resistance to an antibiotic, and so if that's the case, sometimes it's nice to have the option to go back and do testing for penicillin and find out if a person is truly allergic to it or not.
Okay, so what does that involve, this testing?
We have people come into the office and do several scratch tests, which are simple, and if they're positive, we know that they're allergic to penicillin. If they're negative, then sometimes we'll even challenge them with a dose of penicillin in the office to make sure that they're fine.
Oh, so is it fairly simple, this procedure to be tested?
It's fairly simple, and it's something that's actually could be used a lot more, I think, and allow people to take a cheaper medication that's still very effective, and it gives them more choices on antibiotics.
Can you outgrow your sensitivity to penicillin?
You can. That's a great question. And sometimes a person is truly allergic to it and maybe had penicillin as a child, but with years have lost that sensitivity. Should
a parent be worried if they take their child in now for this testing that they may overreact and something could go wrong?
We can do the test in a safe manner so that it's safe and controlled, and if there is a reaction, we can treat it.
Oh, great! So the best way to do it then is just to call up for an appointment and come on in and be tested.
That's right. That's what they should do, especially if they're getting limited on the number of choices of antibiotics they could take or taking some of these more expensive ones.
All right, good to know.
Thank you.
Advice. Thanks for being here today.
Thank you.
And for more information on allergy, asthma, and immunology associates, visit momseveryday.com or download the Moms Everyday app.
Visit Moms Every Day online or on the go through our Moms Every Day app. Download it today to find local solutions for you and your family.